Did you know 65% of women aged from 15 to 49 years rely on birth control? And for those over 40, hormone replacement therapy (HRT) becomes critical. Yet, thousands of women use these drugs without knowing the risks of combining them with medications like Mounjaro. You might be one of these women, perhaps getting your injections supplied privately and unaware of critical risks of taking these together. Today, we reveal what every woman must know to stay safe. Hi, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. We've gotten hundreds of questions about Mounjaro's hidden interactions with women's medications. This video focuses exclusively on the interaction with birth control drugs and HRT, which are two key drugs in women's health that demand your full attention when you're also using Mounjaro. But before we dive in, a quick refresher. Mounjaro works by 1. Slowing the gastric or stomach emptying up to 70%, which means food and pills staying longer in your stomach. It also enhances the sensitivity to insulin, and this revolutionary mechanism causes effective weight loss, but it also disrupts the absorption of oral medications really within an hour of taking the injection. Now, if you're here for the interaction with HRT, jump to this timestamp here. But first, birth control users, this section affects you most critically. Oral birth control medicine or contraception drugs rely on the timely absorption of the medicine from the gut into the bloodstream. Mounjaro could delay this by up to 3 to 4 hours. Studies show the effectiveness drops, meaning the theoretical failure risk of taking the pill nears 50%, nearly half, if it's not timed correctly. Now, this applies if you're taking oral birth control pills or tablets. So the recommended solutions are to switch to a non-oral birth control or add on condoms, use condoms during sex, and on the day you take the injection, take the pill 3 hours before having the injection. If you're using birth control patch, the ring, IUDs, implants, or injections, you're safe and don't need to make any changes. In fact, the best option for anyone on Mounjaro is the coil or IUD or implant to reduce the risk of pregnancy while on the injection. And I'm going to touch on that in just a minute, why that's really important in just a minute. But here's another tip that people using the birth control pills should be aware of. I get many women calling because they've experienced vomiting or diarrhea while taking Mounjaro. It's a common side effect. If you're still on the pill when this happens, remember your missed pill rules. Yes, so that means use a backup method for 7 days. In addition, after any days increase with Mounjaro, you will need another 4 weeks of backup to your regular oral birth control tablet or contraception. So, do you see why it's simpler to switch to a longer lasting non-oral method if it's possible and suitable for you? Think about it. But now let's look at preconception and pregnancy and how that relates to Mounjaro. First, let's talk about fertility. Now, weight loss, losing weight, boosts ovulation. Studies on women with PCOS, polycystic ovary syndrome, have demonstrated this. So, as you lose weight on Mounjaro, your fertility improves. However, Mounjaro has been shown in animal studies to cause abnormalities in the growing fetus. So, you should stop Mounjaro at the very least a minimum of 2 months before trying to get pregnant. After stopping Mounjaro for at least a 2-month period, take a pregnancy test immediately before you start trying to get pregnant. While the waiting period ensures the drug clearance from your system, the pregnancy test will confirm that you're not already pregnant. And that's really critical because the injection could linger in your system in very early pregnancy and you don't even realize. The second tip I want to mention is about emergency contraception. So are you taking Mounjaro and something's happened and your regular birth control failed and you need an emergency birth control method? The copper coil, the copper IUD, not the morning after pill, is the most effective emergency option due to those absorption issues that we've already talked about. So please remember, it's the copper coil. Okay, now my sisters on HRT, let us talk. So although we have less information about the interactions with HRT compared to the pill, the effect on HRT taken by mouth is lower thanks to those same issues around delayed absorption. This affects both estrogen and progesterone taken by mouth. The absorption of your medicine can drop 40 to 50%. This drop can lead to symptoms like uncontrolled hot flushes, mood swings, other menopause symptoms that were previously under control. But there's another issue. In women taking combined HRT, which is women who have their womb, that is, they've not had surgery to remove the womb, thanks to poor progesterone uptake, if it's taken by mouth, there is an increased risk of womb cancer. And this happens because there is no protection of progesterone from the unopposed effects of estrogen on the womb. So if you're using HRT, what should you do? Well, if you're taking HRT patches and gels, these are 100% safe. Absorption is not affected. You can continue using them. Patches avoid absorption issues that we see with the oral HRT. Vaginal creams are ideal for local symptoms, again, not affected by Mounjaro or any of the weight loss injections. The Mirena coil or IUD is the best method to deliver progesterone, the progesterone part of your HRT. Now, if you're using HRT by mouth and you wish to continue or you need to continue, see your doctor about adjusting the dose or other options. Now, adjusting the dose will be important, especially every time you change the dose of the injection. So you need to speak to your doctor about how to manage this. But another option is to switch from the oral to the combined transdermal methods. Now, remember, even though we don't yet have enough direct evidence about HRT and Mounjaro interactions, using the transdermal method is still likely safer than the oral HRT. The patches, gels, other non-oral methods, they're preferred because there's fewer problems with absorption, lower or fewer side effect risks like blood clots. So ladies, no need for guessing. If you take away just one thing from today's video, it's that oral medications, the pill, HRT, and Mounjaro are like mixing oil and water. So please save this video, go and bookmark it somewhere, but share it with a friend as well, or with your GP if you want to have that conversation. And thank you for subscribing to my channel. So go ahead and check out some valuable resources, guides, and tools we have in the description box below, or check out this next video. And I will see you again soon.